Write down the principle and technique of mammography. Principle of mammography. So what is mammography? It is a technique of radiographic examination of the breast known as mammography. Breast is composed of fatty tissue, connective tissue and glandular tissue. A specially made X-ray tube and a special exposure parameters is needed compared to conventional radiography. What are the parameters? Parameters are cathode. Single filament cathode consists of fine tungsten filament. Anode, rotating anode, which is made up of molybdenum, atomic number 42. Anode angle 0 to 10 degree and focal spot 0.3 millimeter of thickness. Tube current 100 milliampere second, exposure time 1 to 2 second, and kbp 25 to 40. Somewhere it is given 25 to 36 kbp, on an average 19 kbp. Tube port made by beryllium having atomic number 4. Filter molybdenum 0.03 millimeter thick. So molybdenum filter and anode is also from molybdenum. Now molybdenum and rhodium filter is using currently, but mostly molybdenum is used. Mammographic film, single layer of emulsion. Usually in case of radiography there is 2 layer of emulsion, but in case of mammography single layer emulsion, single screen, slow speed, extremely fine grain and high contrast, and mammographic screen is low speed and single screen. What is technique? During a mammography, a patient breast is placed on a flat support plate and compressed with a parallel plate called paddle, and an X-ray machine produces a small amount of X-ray that passes through the breast to a detector on the opposite side. The detector can either be a photographic film plate which captures the X-ray image on the film, or a solid state detector which transmits electric signal to a computer to form a digital image. The images are produced called mammogram. On a film mammogram, low density tissue such as fat appears translucent, that is radiolucent, whereas dense tissue such as connective tissue and glandular tissue or tumors appear radio-opaque, that is opaque on the grey background. So two images, that is compression plate and film, and in between that the breast tissue is present, that is craniocaudal view and MLO view, medial lateral oblique view, which is two views are usually done. What are the medical hazards in case of mammography? So radiation hazard can increase the risk of developing cancer in the later life. The risk of radiation exposure may be higher for younger women. False results can be false positive or false negative results. Additional imaging. If a mammogram detects an area of concern, additional imaging may be necessary, such as ultrasound or biopsy. Discomfort. Compression paddle used in mammogram can cause patient discomfort. Mammogram can't detect all cancer, especially the area are difficult to view or where breast density is very much high. In that area, sometimes micro calcification couldn't be detected. So these are the hazards of mammography. Describe the special technical aspects of mammography. So what are the special technical aspects? KVP, filter, target, filament, then tissue thickness, exposure time, then film, about the film. So KBP, so we have earlier discussed that 25 to 40 or 36. So low KBP on an average 19. We use average 19 kpp, that is characteristic radiation. There are two types of radiation, bremsstrahlung radiation and characteristic radiation. We use characteristic radiation, and that is 19.6 and 17.5 kV on an average 19. Filter, molybdenum filter, as earlier described, molybdenum or rhodium. So usually molybdenum having 0.03 millimeter thickness. Almost monoenergetic X-ray is used. By using filter, other energy are absorbed. So it is almost monoenergetic because the higher range of radiation, that high energy X-rays are absorbed by the filter, because we need monoenergetic X-ray for better tissue contrast in the film. Target molybdenum, atomic number 42. Then filament, 0.3 millimeter fine tungsten filament, which is used. Tissue thickness, 3 to 6 millimeter of tissue thickness of compressed breast, needs 30 to 40 kilovolt potential on an average 19 kbp for good contrast. If we will not use compression paddle, then there will be high tissue density and there will be more scatter radiation, and contrast of X-ray film will be low. So compression should be applied in the breast parallel to the paddle or compression plate, and exposure time is 1 to 4 seconds. Longer exposure time, which is not given in conventional radiography that much time. There is some reason, that's why we used to give, because we are giving monoenergetic X-ray, and which is in only 19 kbp. As so here is production of the photoelectric interaction, because it is mostly depend on the atomic number, not in density, because almost fat and glandular tissue have the almost similar density, that is 0.91 and 1. So it is not that much variation, so compton interaction will be less and it doesn't differentiate in the contrast. So photoelectric interaction is happening, and to produce more photoelectric interaction we use longer exposure time, slow speed of the phosphor, single emulsion film and single screen. Why special exposure factors are used in case of mammography? Explained through physics. So we all know, we have previously discussed about the kbp and milliampere filter, all these things, but what is the special exposure factors? So exposure factors include kbp. So why we are using low kbp and why we are giving in longer exposure time? So mammography is a radiographic examination of the breast. Breast consists of two types of tissue: soft tissue, that is fat, and glandular and connective tissue. So soft tissue of water density, that is muscle gland, fibrous tissue and blood vessels, and fat. With conventional exposure factors, these tissue exhibit poor radiographic subject contrast, but with suitable exposure factors, the radiographic contrast between the soft tissue and fat is enhanced, which is necessary for us in case of mammography. Why low kbp? 24 to 32 kb. Somewhere it is given 25 to 40, 25 to 36, which is low, by the way. We use low kbp X-ray because a small difference in the atomic number between the breast tissue produce no subject contrast unless maximum photoelectric effect is used. A breast composed of soft tissue, muscles, gland, blood vessels, fibrous tissue and fat, and structures, that is main fat and soft tissue. Fat having atomic number 5.9 to 6.3 and soft tissue having 7.4, and density of the fat is 0.91 and soft tissue 1, which I described earlier. So density difference is less, so no role of Compton interaction. 0.9 is of fat and soft tissue have 1, so 0.1, that is a soft tissue density difference, so it doesn't affect at all. So what about the atomic number? So atomic number of the fat on an average 6.2 and soft tissue 7.4. So photoelectric interaction is directly proportional to the cube of the atomic number and inversely proportional to the energy cube, that is inversely proportional. So atomic number is directly proportional. So on cubing the 6.2 divided by 7.4, we got 1:2 fat versus soft tissue contrast. So Compton interaction in mammography is 15%. So we use 100% photoelectric interaction, then the contrast ratio will be 1:2. Again, there is another thing is that why higher dose, that is 7 millisievert in mammography, whereas in normal chest X-ray that is only 0.3 millisievert in chest X-ray dose. So the main thing is longer exposure time, 1 to 4 seconds, a predominant photoelectric interaction, that we assume 100%. That is two things that causes 7 millisievert in mammography, whereas 0.3 millisievert in case of chest X-ray radiography. Why long exposure is needed, or what are special milliampere second, the 200 to 250 milliampere second? Because X-ray production is less in mammography due to use of low atomic number, that is molybdenum produce less amount of X-ray in comparison to tungsten anode. So low atomic number, Z equals to 42 of the molybdenum target. Low tube voltage of, that is 30 to 40 kVp, and use molybdenum filter. X-ray beam are severely attenuated by the breast tissue due to photoelectric interaction. So if you give in the short time, breast tissue absorb the X-ray radiation or X-ray attenuated in the breast tissue, but it does not goes up to the photographic film, so we cannot detect on the photographic film, so ultimately film contrast will not be good. An inherent filtration of some X-rays tube reduce the X-ray quality. We know everyone that there are some inherent filtration by the glass, X-ray glass, and inherent by the target. Then X-ray pass through the window to exposure area. Inherent filtration of some X-ray tube reduce the X-ray quantity, so less X-ray reach the film and density decrease and contrast decrease. So that's why long exposure time is needed, so that sufficient amount of X-ray reach the time to produce the better image. So everything included in that concept: the low atomic number, low tube voltage, low use of a filter, X-ray emitted by the breast tissue due to photoelectric interaction, and inherent filtration. All are the causes of why long exposure is needed, or a special milliampere second, 200 to 250 milliampere second. Then molybdenum target and filter. In mammography tube, two characteristic radiation, 17.5 and 19.6 kiloelectron volt energy are produced, and also bremester long, each all produced with energy higher than 20 kiloelectron volt. BSR reduce contrast in bremester long. BSR means reduce contrast in breast soft tissue structure. So to remove the X-ray which is more than 20 kiloelectron volt, we use filter. If same MO, that is molybdenum target and MO filter are used, lower and upper energy of mean energy X-rays cutoff. KSL age of the molybdenum is 20 kiloelectron volt, so it removes the X-ray of more than 20 kiloelectron volt by the photoelectric interaction, and it acts as the spectral window, so the useful beam enters as almost monoenergetic X-ray. So we get good quality film is produced. That is why molybdenum target and molybdenum rhodium filter is used. Why molybdenum and target and filter is used? Why tissue compression is important in case of mammogram? So tissue compression is important in the case of mammogram. There are some reasons. That is, in case of uncompressed breast, it is in natural shape, and there is some variation in the shape where there is some less thickness. There will be for suppose this one is the shape, here more thickness, here less thickness, here less thickness. So the thing will be that here will be more attenuated, and so it will not reach the X-ray to the film, whereas in this area more will be attenuated and the X-ray density will be more high, it will be blackening and there will be whitening, so there will be contrast disruption. That's why to make uniform thickness, this one is the breast, and by giving the two compression parallel from the above and downward, it puts in the shape and compression parallel gives, now it will be equally uniform compressed breast shape. So suppose breast which is 6 centimeter and 75 centimeter square in shape and size, which is uncompressed. So a scatter by primary ratio is 1, but if we will compress, then 6 centimeter will be 3 centimeter and 75 will be 150 centimeter square centimeter. So this thickness is increased, but this thickness is decreased, so it will be uniform. A scatter by primary ratio is 0.4, means it is reduced by 0.6. So what are the reasons why use tissue compression in mammography? Hold the breast in place to minimize the blurring of the X-ray image that can be caused by patient motion. So there will be less motion artifact or movement blurring. Evens out the shape of the breast so that the X-ray can travel through a short path to reach the detector. This reduces the radiation dose and improves the quality of X-ray image, reducing scatter radiation. That reduce scatter radiation, reduce X-ray dose, and improved spatial resolution, means tissue contrast between two different test structures. Allow all the tissue to be visualized in a roughly single plane, so that small abnormalities are less likely to be obscured by the overlying breast tissue, and reduce tissue overlap. All are the reasons. That's why we use tissue compression on case of mammography. How does digital tomosynthesis work? Discuss the advantage of tomosynthesis compared to general 2D mammography. How mammography differs from digital tomosynthesis. Why tomosynthesis is needed in case of breast imaging. So we can see that in case of 2D mammography, we give exposure from the one side and detected by the other side. That is normal 2D mammography. It is not 3D. There is no reconstruction, just detection is done. That is 2D mammogram. It has taken two view, craniocaudal and MLO. Sometimes a special view is also taken, extensive view. In case of digital tomosynthesis, multiple, it is taking just like OPG, orthopantomogram, that is done in case of teeth. In an arc it is taken, but there both had moving simultaneously, but here is one moving simultaneously. Detect is just below. So what is digital tomosynthesis? The tomosynthesis is an imaging technique in which multiple X-rays of one object are taken from a discrete number of angles. These cross-sectional images are used to reconstruct 3D image of the object being scanned. A conventional X-ray examination of the breast called mammogram is two-dimensional. Two X-ray images are taken out of the breast from the top to the bottom, that is craniocaudal, and from angle side to side. What is the working principle? In breast tomosynthesis, the X-ray tube moves in an arc over the compressed breast, capturing multiple images of each breast from discrete angles. These digital images are then reconstructed or synthesized in a set of three-dimensional images by the computer. The X-ray tube is rotated over a limited angular range. A series of low-dose exposures are made every degree, creating a series of digital images. Typically, the tube is rotated through 10 to 20 degrees and 10 to 20 exposure. 10 to 20 degrees and 10 to 20 exposure are made every 1 degree angle. So during a total scan of 5 seconds or less. So suppose this one is the breast tissue. One is given from here, one is from here, one is from here. In this way, 10 to 20 exposures are given, 1 degree angle difference. And then the image is reconstructed by the computer in the 3D image. And then we interpret. That is called digital tomosynthesis or 3D mammography. And what is the difference between 2D and 3D? That is 2D mammography and 3D, that is digital tomosynthesis. In case of 2D, takes one image from the top and one from side to side, that is craniocaudal and MLO. In case of digital tomosynthesis, we know multiple images in an arc like pattern, creating a detailed image, that is 10 to 20 exposures and 10 to 20 degree by giving 1 degree difference angle. So in case of 2D mammography, low X-ray used. In case of digital tomosynthesis, low dose X-ray used. In case of 2D mammography, scan time is 1 to 4 seconds, usually 2 to 3 seconds. But in case of digital, 5 seconds or less. So it is much more time consuming than 2D. Advantage: 2D mammography is a gold standard imaging procedure for breast cancer screening. What are the advantages? Digital tomosynthesis more sensitive in detecting cancer in dense breast tissue, screening and diagnostic exam. Can detect earlier stage of breast cancer due to clear image quality, more accurate export view digital system are available to help to guide in the breast biopsy. So it can be help in breast biopsy. Can reduce or eliminate tissue overlap effect. These are the differences. What is the role of ABVS in breast imaging? What are the advantages of ABVS? So what is ABVS? Automated breast volume scanner. So it is basically one type of ultrasound. So ultrasound is used, but it is not done by any skilled person. It is actually it is totally done by the machine, and we just see the interpretation. So it's just like one type of we can say 3D mammography or CT MRI scanning, because there is no role of operator actually that much. So automated breast volume scanner is the latest technology in breast cancer detection in patient with dense breast tissue. In patient with dense breast tissue, 3D mammography is also effective, and as well as that is the radiation exposure. But in case of ABVS, it is ultrasound technique, so there is no radiation exposure. This machine ABVS, this machine allows a clearer, more detailed image as a follow-up of the conventional mammogram, conventional 2D mammogram. Breast density can be a critical factor in breast cancer detection. Dense breast tissue appears white on mammogram, as does cancerous tissue hiding tumors behind it. So dense breast tissue appears white, and cancer tumor, that is calcification, also appear white. So it may be tissue overlap, and it sometimes obscure. So what is the role of ABVS, automated breast volume scanners? Breast cancer screening for asymptomatic women with dense breast tissue. Combined with mammography, the system has been able to detect small, invasive, early stage cancer. As the transducer is large and field of vision is more, volumetric image of entire breast is possible. So here transducer is large, not like a ultrasound probe. It's like a mammography X-ray tube. So it covers the entire breast volume in one scan. So its transducer is large and field of vision is more, so volumetric image of entire breast is possible. Each slice can be examined, so missing of the pathology is unlikely. Advantage: operator independent, that is the advantage. Less time required. 3D image obtained, which can be compared with CT and MRI. So the thing is that we can also compare with CT and MRI. This one can be stored in computer and transfer electronically, so it can include in the PAC system. Probability of misinterpretation is less and less artifact. That's all. So this one is new to, I think is. So automatic breast volume scanner, it is used in case of dense breast tissue. It can also be used as the follow-up scan in case of conventional mammography. And it is the latest technology of the ultrasound, in which volumetric scan of the breast is done by the machine, and there is no role of the operator. So operator is independent, and it is usually done in case of asymptomatic woman and having dense breast tissue, combined with conventional mammography, that is with conjugal. And it can compare with the CT and MRI image. And other thing is that we can include it in the PAC system, because in PAC system we have already discussed that we can use X-ray films, CT and MRI. So it can also be include ABVS, automatic breast volume scanner. Discuss the principle of xeroradiography. Discuss its role in detection. So what is xeroradiography? Xero means dry. So basically there is no use of chemical, that means xeroradiography. In radiography, a selenium coated metal plate substitutes for the X-ray film. The plate is subjected to a positive electric charge before the X-ray exposure is made. The plate is subjected to a positive electric charge before the exposure is made. The charge leaks off onto the selenium in direct relationship with to the X-ray intensity. The plate is then developed under a cloud of negatively charged powder in a light-proof box. Then the image is made permanent by photographing it or transferring it to a variety of papers and plastic with pressure of electrostatics. And here is no use of X-ray film. It is basically print in paper or plastics. Role in detection of the breast lesion: easier to produce and interpret. The entire process is dry and needs no dark room facilities. A single xeroradiograph records with clarities of all density of the breast, including epithelial, connective or fat tissue. Significant structures are shown in greater details than conventional mammography films. Less radiation is required. Thus, xeroradiograph provides greater accuracy in diagnosis.